Here is a short video on metabolic syndrome. The objectives for this video will be to learn more about the background of metabolic syndrome, what elements make up metabolic syndrome, medical management for high blood pressure, high cholesterol, as well as high blood sugars, and discuss lifestyle modification. The National Health and Nutrition Examination Survey now estimates that 30% of Americans have metabolic syndrome. This will increase the risk of developing heart disease, adult-onset diabetes, and some forms of cancer, to include colorectal cancer and cancer of the pancreas. African Americans have an increased risk of developing high blood pressure. Approximately 54% of this population currently have high blood pressure. Of those prescribed blood pressure medications, only 25% are adequately controlled on medication. There is also an increased risk of developing adult-onset diabetes. So, what is metabolic syndrome? The International Diabetic Federation would classify metabolic syndrome as having at least 3 of the following 5 elements present, but must include the size of the waist being 40 inches or larger in men, or 35 inches or larger in women. If the BMI, body mass index, is 30 or more, the size of the waist may be assumed to fit this criteria. The second element would be if triglycerides are 150 or more, or if the individual is on medication for high triglycerides. The third would be if the high-density lipoprotein, HDL, is 40 or less in men and 50 or less in women, or if the individual is on medication for low HDL. Next, blood pressure would be considered a component if the top number is 135 or higher, and or the bottom number is 85 or higher. If the individual is on medication for high blood pressure, they would fit this criteria. Lastly, blood sugars 100 or more before eating, or if the individual is on medication for high blood sugars. Obesity can be defined using the body mass index, or BMI. Obesity is present if BMI is 30 or greater. Overweight is between 25 to 29.9, and normal weight is anywhere between 18.5 to 24.9. The Centers for Disease Control and Prevention have noted that approximately 50% of African Americans are obese at this time. Some cholesterol is necessary to maintain a healthy body. When cholesterol goes outside of a normal range, it can negatively impact our health. Let's talk a little bit more about some of the components that make up our cholesterol. Low-density lipoprotein, or LDL, is often called the bad cholesterol. Higher levels increase the risk of damage to our heart. High-density lipoproteins, or HDL, is the good cholesterol. This cholesterol can help to protect our heart against damage. Triglycerides are another component of our cholesterol. Higher levels have also been shown to increase the risk of damage to our heart. Cholesterol can directly be affected by foods that we eat, as well as close family members having high cholesterol. Some examples of medications to help control high cholesterol include Lipitor and Crestor. The American Heart Association would define high blood pressure as a blood pressure greater or equal to 130/80. High blood pressure over time increases the risk of having a stroke, heart failure, heart attack, and may also damage our eyes, kidneys, and brain. Medications that are often used for high blood pressure include hydrochlorothiazide, lisinopril, metoprolol, and losartan. High blood sugar can be defined as a blood sugar that is greater than or equal to 100 without anything to eat or drink within the past 6 hours. Having a high blood sugar does increase the risk of developing type 2 diabetes or adult onset diabetes. Symptoms may include increased thirst, increased urination, and increased hunger. Metformin is often used to help control high blood sugars. So, what can we do to help decrease our risk of metabolic syndrome? Losing weight, especially around our waist, can greatly reduce the risk of metabolic syndrome. Exercising for at least 30 minutes a day, most days of the week, can also help to reduce our risk of metabolic syndrome. Not using cigarettes or other tobacco products can also help to lower our risk. Know your risk and know your numbers. Talk to your healthcare provider and make sure you know the size of your waist, cholesterol, blood pressure, and blood sugar. I cannot thank you enough for your time. Please don't hesitate to contact me if you have any questions or concerns. Thank you again.